Autism is unfortunately not just related to social problems. There are also a number of medical comorbidities that go along with autism. The three most common are problems with sleep, problems with GI distress or gastrointestinal distress, including reflux, and seizures or seizure disorders. And these are real medical comorbidities and real problems. They need to be addressed very early on so that we can improve the medical functioning of the child, but also the quality of life for the family. Because, for example, when a child isn't sleeping, it really influences the quality of life of the entire family. So on the medical comorbidity side, for sleep, we really want to look at making sure that we know exactly what's causing the sleep disturbance. There are some kids with autism, for example, that have a lot of trouble going to sleep, but if we put some behavioral interventions in place and some environmental modifications, they can actually get to sleep and stay asleep and do quite well. So for example, some kids with autism, they really need a nighttime routine. And we need to make sure that, for example, they have a little nighttime snack, they go to the bathroom before they go to bed, because that way they're less likely to wake up in the middle of the night. We want to make sure that their room is dark, for example. For some kids, they really need a dark room in order to be able to fall asleep. And we need to make sure that there's sort of this regular, very consistent routine. Maybe they take a bath, put on their pajamas, sit and watch a little show or read a book, and then they go up to their room and go to bed. Another part of the environmental modification is really that the child's room is for sleep rather than play. So for example, I've had some kids that we just took the TV out of the bedroom, and that was enough. Now the room was such that they could fall asleep. But the TV was so stimulating that they weren't able to get to sleep. On the gastrointestinal side, it's really important to have the child see a gastrointestinal specialist. A GI specialist, a pediatric specialist, is really important because there are some kids that have sort of primary GI disorders that need to be addressed. And that kind of doctor is really going to help you to sort out whether it's a diet issue or some kind of primary disorder, or maybe a combination of both that need to be managed for that child. And in terms of seizures, there's a disproportionate number of kids with autism that have seizures. There are some kids that develop seizures earlier in their life, and then there are actually some kids with autism that develop them in adolescence. And obviously, seizures are a very serious condition that needs to be addressed by seeing a pediatric neurologist, a neurology specialist. And for kids with autism who have seizures, they need to be appropriately evaluated with an EEG, and then that doctor can decide what's the most appropriate treatment course for those children.